rebels who have staged a number of rebellions in recent months, one of them around about 100 MPs. Critics, of course, claim that the Prime Minister is giving Tory backbenchers what they want because his position is precarious because of all the allegations of partying in Downing Street, the threat of letters to the chairman of the 1922 committee, Sir Graham Brady, demanding a vote of confidence in him, and of course a police investigation. It's only last Friday that Number 10 confirmed that the PM had sent back his questionnaire to the Metropolitan Police about his involvement in gatherings in Number 10, which it's claimed were parties. He's claimed in some of his statements at Prime Minister's questions that they were work events. Now, the Prime Minister has been under pressure. He's rebuilt his team inside Number 10. He's changed his chief whip. That Mark Spencer's moved to the post of Leader of the House of Commons. He's due to make a statement later this afternoon on changing Commons business. That may well be that we're going to get some votes in the Commons in the next few days on getting rid of these COVID rules. So there's been what some have called a reset of the Prime Minister's operation, what others have called steadying the ship. I must admit the ship didn't look very steady earlier on today when Cabinet Ministers went into Downing Street one minute and came out the next. It looked very chaotic. But we are told, as I began by saying, that Number 10 have said that the Cabinet has approved Cabinet gave unanimous backing to the Living with COVID strategy. So I can see in the House of Commons some of his most loyal supporters are on the government front bench. Nadine Dorries, in particular, for example, one of his chief cheerleader almost in the Cabinet. The chamber is really filling up now. It was fairly full for the Ukraine statement, but it's filling up now. So my guess is that the statement and the exchanges after the PM's statement will go on for a good hour and a half, I would guess. There's just a few Tory MPs on their feet now, so I think we're coming towards the end, possibly, of the Ukraine statement. But there you can see the chamber on the right-hand side of your picture. A few gaps at this end of the chamber, as you can see. On the right-hand side, that's where the SNP MPs sit. Of course, these restrictions are for England only, it's worth pointing out. And that's, I think, one of the SNP MPs speaking there. And of course, the leaders of the Welsh and Scottish devolved administrations have criticised the Prime Minister, particularly on the proposal to end free testing. And so there's Steve Barclay. You see, you perhaps can't see actually. Steve Barclay is next to the Defence Secretary. He's talking to Nadine Dorries at the moment, and we are getting close to that common statement. Peter Bone, I can tell you, is on his feet now on Ukraine, but a lot of anticipation of this big common statement from Boris Johnson. The Prime Minister is not yet in the chamber, but Cabinet Ministers are coming in. The new Chief Whip is in his place. That's Chris Heaton-Harris, one of the changes the Prime Minister made. But we are going to hear from the PM changes in England. Should stress that this is just England, and it's the ending of isolation, the ending potentially of free testing, or there's a suggestion perhaps over 80s might continue to get free tests. Be interesting to see what the PM has to say about those passenger locator forms for when we all go abroad. They're controversial, they're unpopular, may or may not get some announcement of when they may go. But what we are expecting is that self-isolation for testing positive will go probably this Thursday in a move that will be cheered loudly by the vast majority, if not all, Conservative MPs. As I say, the Prime Minister has called it a moment of pride. The PM's moment of pride is fast approaching, although, as I say, Mr Wallace is still talking about Ukraine at the moment.
That matter very much dominating the Commons so far this afternoon before the PM enters the Commons and stands up to deliver that plan as it has been agreed by him and Cabinet today. John, as you said, there have been bumps in the road in the build-up to this. We are expecting that statement as soon as this debate on Ukraine comes to a close. Following the statement in the House of Commons from the Prime Minister, John, we are expecting a press conference tonight. What are we going to get in that that's different to what we're going to hear in a few minutes?
Not very much, really. I mean, the Prime Minister will obviously lay out his proposals in the same way as he does in his common statement. Usually the announcements don't differ. The questions are likely to be different, though, as opposed to MPs. Obviously, it's political and, in some cases, health journalists. I think we can possibly expect a few more attempts to get the Prime Minister to talk about whether he's going to quit if he gets a fixed penalty notice. In a television interview yesterday, he was asked repeatedly if he would quit if a Prime Minister should quit if fined in a fixed penalty notice. I lost count of the number of times he ducked that question. He said he would have more to say about that when the police investigation was over. So, yes, I mean, I would say this, wouldn't I? I'm biased, but I always reckon that political journalists ask better questions than members of Parliament. They'd probably dispute that. But, OK, we'll get some tough questions from the opposition. But I guess there'll be a pretty warm welcome from the PM, from Conservative backbenchers. The most hostile questions will presumably come from the Labour side and the SNP side. I think I can see Ian Blackford in his place in the chamber. That seat he normally sits below the gangway, just opposite, just to the left of the government front bench. Yes, I think you can see there Ian Blackford in his grey suit, just on the right, on the front row of the SNP benches. But very few SNP MPs in the chamber. And in fact, there's a few gaps on the Labour side as well, actually, you can see there. But look how packed those Tory benches are. They're pretty full. They've been full for Mr Wallace's statement, and I guess probably they will fill up even more. You can see
John, the Prime Minister's just walked in, so we must literally be moments away now. Yes,
yes, indeed. Prime Minister's questions, he comes in when Lindsay Hoyle calls him, no doubt to get an even bigger cheer. My guess is, I wasn't able to hear if there was a cheer this time. I didn't see any waving of order papers either. But here's Sir Lindsay now on his feet. I think we're about to get underway.
We now come to the statement. Prime Minister.
Mr Speaker, with permission, I'll make a statement on our strategy for living with COVID. And before I begin, I know the whole House will join me in sending our best wishes to Her Majesty the Queen for a full and swift recovery. It is a reminder that this virus has not gone away. But because of the efforts we've made as a country over the past 2 years, we can now deal with it in a very different way, moving from government restrictions to personal responsibility. So we protect ourselves without losing our liberties and maintaining our contingent capabilities so we can respond rapidly to any new variant. Mr Speaker, the UK was the first country in the world to administer an approved vaccine and the first European nation to protect half our population with at least one dose. And having made that decision to refocus our NHS this winter on the campaign to get boosted now, we were the first major European nation to boost half our population too. And it's because of the extraordinary success of this vaccination programme that we've been able to lift our restrictions earlier than other comparable countries, opening up last summer while others remained closed, and keeping things open this winter while others shut down again, making us one of the most open economies and societies in Europe, with the fastest growth anywhere in the G7 last year. And while the pandemic is not over, we have now passed the peak of the Omicron wave, with cases falling, hospitalisations in England now fewer than 10,000 and still falling, and the link between infection and severe disease substantially weakened. Over 71% of all adults are now boosted in England, including 93% of those aged 70 and over. And together with the treatments and scientific understanding of the virus that we've built up, we now have sufficient levels of immunity to complete the transition from protecting people with government interventions to relying on vaccines and treatments as our first line of defence. As we have throughout the past 2 years, we will continue to work closely with the devolved administrations as they decide how to take forward their own plans. And today's strategy shows how we will structure our approach in England around 4 principles. First, we will remove all remaining domestic restrictions in law. From this Thursday, 24th of February, we will end the legal requirement to self-isolate following a positive test. And so we will also end self-isolation support payments, although COVID provisions for statutory sick pay can still be claimed for a further month. We will end routine contact tracing and no longer ask fully vaccinated close contacts and those under 18 to test daily for 7 days. And we will remove the legal requirement for close contacts who are not fully vaccinated to self-isolate. Until the 1st of April, we will still advise people who test positive to stay at home, but after that, we will encourage people with COVID-19 symptoms to exercise personal responsibility, just as we encourage people who may have flu to be considerate to others. Mr. Speaker, it's only because levels of immunity are so high and deaths are now, if anything, below where you would normally expect for this time of year, that we can lift these restrictions. And it's only because we know Omicron is less severe that testing for Omicron, on the colossal scale we've been doing, is much less important and much less valuable in preventing serious illness. We should be proud that the UK has established the biggest testing programme per person of any large country in the world. This came at vast cost. The test, trace and isolation budget in 2020-2021 exceeded the entire budget of the Home Office. It cost a further £15.7 billion in this financial year and £2 billion in January alone at the height of the Omicron wave. We must now scale this back. From today, we're removing the guidance for staff and students in most education and childcare settings to undertake twice-weekly asymptomatic testing. And from the 1st of April, when winter is over and the virus will spread less easily, we will end free symptomatic and asymptomatic testing for the general public. We will continue to provide free symptomatic tests to the oldest age groups and those most vulnerable to COVID. And in line with the practice in many other countries, we're working with retailers to ensure that everyone who wants to can buy a test. From April the 1st, we will also no longer recommend the use of voluntary COVID status certification, although the NHS app will continue to allow people to indicate their vaccination status for international travel. Mr. Speaker, the government will also expire all temporary provisions of the Coronavirus Act. Of the original 40, 20 have already expired and 16 will expire on the 24th of March. And the last 4, relating to innovations in public service, will expire 6 months later after we have made those improvements permanent via other means. Second, we will continue to protect the most vulnerable with targeted vaccines and treatments. The UK government has procured enough doses of vaccine to anticipate a wide range of possible JCVI recommendations. And today, we're taking further action to guard against a possible resurgence of the virus, accepting JCVI advice for a new spring booster offered to those aged 75 and older, to older care home residents, and those over 12 who are immunosuppressed. The UK is also leading the way on antivirals and therapeutics, with our antivirals task force securing a supply of almost 5 million, more per head than any other country in Europe. Third, SAGE advised there is considerable uncertainty about the future path of the pandemic, and there may, of course, be significant resurgences. They are certain there will be new variants, and it is very possible they will be worse than Omicron. So we will maintain our resilience to manage and respond to these risks, including our world-leading ONS survey, which will allow us to continue tracking the virus in granular detail, with regional and age breakdowns helping us to spot surges as and where they happen, and our laboratory networks will help us understand the evolution of the virus and identify any changes in characteristics. We will prepare and maintain our capabilities to ramp up testing. We will continue to support other countries in developing their own surveillance capabilities, because a new variant can emerge anywhere. And we will meet our commitment to donate 100 million vaccine doses by June as part of our agreement at the UK's G7 summit to provide 1 billion doses to vaccinate the world over the next year. In all circumstances, our aim will be to manage and respond to future risks through more routine public health interventions, with pharmaceutical interventions as the first line of defence. Fourth, we will build on the innovation that has defined the best of our response to the pandemic. The Vaccines Task Force will continue to ensure that the UK has access to effective vaccines as they become available, already securing contracts with manufacturers trialling bivalent vaccines which would provide protection against COVID variants. The Therapeutics Task Force will continue to support 7 national priority clinical trial platforms focused on prevention, novel treatments, and treatments for long COVID. We are refreshing our biosecurity strategy to protect the UK against natural zoonosis and accidental laboratory leaks, as well as the potential for biological threats emanating from state and non-state actors. And building on the 5-point plan I set out at the UN and the agreements reached at the UK's G7 last year, we are working with our international partners on future pandemic preparedness, including through a new pandemic treaty, an effective early warning system or global pandemic radar, and a mission to make safe and effective diagnostics, therapeutics, and vaccines available within the first 100 days of a future pandemic threat being identified. And we will be hosting a global pandemic preparedness summit next month. Mr. Speaker, COVID will not suddenly disappear. So those who would wait for a total end to this war before lifting the remaining regulations would be restricting the liberties of the British people for a long time to come. This government does not believe that that is right or necessary. Restrictions pose a heavy toll on our economy, our society, our mental well-being, and on the life chances of our children. And we do not need to pay that cost any longer. We have a population that is protected by the biggest vaccination programme in our history. We have the antivirals, the treatments, and the scientific understanding of this virus. And we have the capabilities to respond rapidly to any resurgence or new variant. And, Mr. Speaker, it is time that we got our confidence back. We don't need laws to compel people to be considerate to others. We can rely on that sense of responsibility towards one another, providing practical advice in the knowledge that people will follow it to avoid infecting loved ones and others. So let us learn to live with this virus and continue protecting ourselves and others without restricting our freedoms. And in that spirit, Mr. Speaker, I commend this statement to the House.
Can I just... Mr. Sherman, please. Can I just say, I understand the statement was important and the Prime Minister did run over, so I'm more than happy for the opposition leaders to also run over. Keir Starmer.
Yeah. Thank you, Mr. Speaker. Can I start by sending my condolences to the family of Christopher Stalford? Christopher was a dedicated servant of the people of South Belfast, and his loss will be deeply felt. I'd also like to send our best wishes to Her Majesty the Queen, and as the Prime Minister said, the whole House wishes her a speedy recovery. Yeah. Can I thank the Prime Minister for an advance copy of his statement and for the briefing earlier this afternoon? Mr. Speaker, huge efforts have been made over the last 2 years, and we would not be where we are today without the heroism of our NHS and key workers, those who pioneered and rolled out the vaccines, and the sacrifices that people made every day to follow the rules and protect our public health. We must honour the collective sacrifices of the British people and do everything possible to prevent a return to the loss and lockdowns we've seen over the last 2 years. The Prime Minister promised to present a plan for living with COVID. But all we've got today is yet more chaos and disarray. Not enough to prepare us for the new variants which may yet develop. An approach which seems to think that living with COVID means simply ignoring it. This morning, he couldn't even persuade his own health secretary to agree the plan. So what confidence can the public have that this is the right approach? Mr. Speaker, let me be clear. The Labour Party does not want to see restrictions in place for a moment longer than necessary. But, Mr. Speaker, we have to take the public with us, and that requires clarity.
Order. If you can't show the respect that I expect the Prime Minister to be heard in silence, I expect the Leader of the Opposition. If you don't wish to be in here, there's plenty of room outside this chamber. I suggest you start using it, and I'll be helping you on your way. So let's have silence. Keir Starmer.
Mr. Speaker, we have to take the public with us, and that requires clarity about why decisions are being made. So will the Prime Minister publish the scientific evidence behind his decision to remove the legal requirement to self-isolate, including the impact on the clinically extremely vulnerable, for whom lockdown has never ended? Having come this far, I know the British people will continue to act responsibly, and they will do the right thing, testing and then isolating if positive. What I can't understand is why the Prime Minister is taking away the tools that will help them to do that. Free tests can't continue forever, but if you're 2-1 up with 10 minutes to go, you don't sub off one of your best defenders. The Prime Minister is also removing self-isolation support payments that allow many people to isolate and weakening sick pay. These are decisions which will hit the lowest paid and the most insecure workers the hardest, including care workers who got us through the toughest parts of the pandemic. It's all very well advising workers to self-isolate, but that won't work unless all workers have the security of knowing that they can afford to do so. The Prime Minister mentioned surveillance and the ONS infection survey. This is crucial to ensuring that we can ramp up testing and vaccination if the virus returns. So can the Prime Minister confirm that he has put the funding in place to ensure that the ONS infection survey will not see reduced capacity and that it will be able to track the virus with the same degree of detail as it can today? We can't turn off Britain's radar before the war is won. Ignorance is bliss is not a responsible approach to a deadly virus. It actually risks undoing all the hard-won progress the British people have achieved over the last 2 years. Mr. Speaker, the Labour Party has published a comprehensive plan for living well with COVID. Our plan would see us learn the lessons of the past 2 years and prepared for new variants. His approach will leave us vulnerable. Where's the plan to secure the UK's supply of testing? Why are schools still not properly ventilated? As a nation, there is no doubt we need to move on from COVID. People need to know their liberties are returning and returning for good. But this is a half-baked announcement from a government paralysed by chaos and incompetence. It is not a plan to live well with COVID. Thank you.
Mr. Speaker, I really thought this was going to be the moment when he would end his run of making the wrong call on every single one the big decisions. But, Mr. Speaker, time and time again, he's had the chance to back the government on the big decisions, and I'm afraid that he's got it wrong. And just turning to some of the points that he's made, the evidence for what we're doing today is amply there in the scientific evidence, in the figures for the rates of infections that I've outlined today, and in all the data that is freely available to members of the House. And they can see what's happening with infection rates, with mortality, with what Omicron is doing across the country, Mr. Speaker. He asks about the clinically extremely vulnerable, and that's, of course, an entirely reasonable question. But what we are going to do is make sure that they continue to be protected with priority access to therapeutics and, of course, to vaccines as well. He asks about testing, Mr. Speaker, which is absolutely satirical, because week after week, month after month, I've listened to the Labour Party, Mr. Speaker, complaining about NHS testing, denouncing the cost. Did you not hear them, Mr. Speaker? Denouncing the cost of NHS test and trace, and now they want to continue with it when, Mr. Speaker, we do not need to go on with it in the way that we are currently doing. So he asks about our ability to do tests, or our domestic ability to manufacture tests. It's as though he doesn't know, Mr. Speaker, that we have in this country now one of the biggest manufacturers of lateral flow tests in Europe. Mr. Speaker, this is a leader of the opposition who, as I say, has shown an absolutely ferocious grip of the wrong end of the stick. He never ceases to amaze. He was wrong on July the 19th. If you remember, totally wrong. He said we shouldn't open up on July the 19th. He said that the Labour Party, there he said that we needed a roadmap back into lockdown, Mr. Speaker, during December. They wanted to stay. He voted several times. They wanted to stay in the European Medicines Agency, and contrary to his denials in this House, Mr. Speaker, he voted several times to do so. He's been consistently wrong on all the big calls. He was wrong then, he's wrong now. What we are doing, Mr. Speaker, is moving forward in a balanced, sensible and proportionate way. Moving forward away from legal compulsion in a way that I think the British people understand, and trusting in them and trusting in their great sense of personal responsibility.
Thank you, Mr. Speaker. I support today's announcement, which is a tribute to British science and to the government's leadership in the vaccine programme. Does the Prime Minister agree, when it comes to future pandemics, that the real danger zone are those early months when we don't have a vaccine against a new virus? And in that context, it's not just whether the NHS can cope, but whether the NHS can cope without switching off other vital life-saving treatments. And if he agrees with that, that it is not just enough to say that we have more doctors and nurses than we had before, but that we also need to make sure we have enough doctors for the future. And if he has plans for that, would he please tell the House how he will make sure that we are actually training enough?
I thank my right honourable friend very much. And he's returning to a theme. He's returning to a theme that he's mentioned several times. We have a vast plan, Mr. Speaker, to recruit more nurses and more doctors than ever before. There already are more in the NHS than at any time in our history. There are 45,000 more now this year healthcare professionals than there were last year, Mr. Speaker, and we will continue to fund them.
Leader of the SNP, Ian Blackford.
Thank you, Mr. Speaker. This statement was billed as the Prime Minister's moment of pride. But it's clear that this morning has been a moment of panic for this government. Disagreement across Whitehall and a lack of any serious engagement with the devolved nations shows that these decisions are bereft of science or consultation. It appears these dangerous choices are purely political and have been made up on the hoof. It is another symptom of a government in turmoil. The illogical reality of UK finance means that these decisions, made for England by a failing Prime Minister, affect the money the devolved nations have to provide testing. It is unacceptable that the ability to protect money, I hear money, we're talking about protecting the people of Scotland, something that this Prime Minister is turning his back on. And it's unacceptable that the ability to protect our population can be imperilled on the basis of a political decision taken by a Prime Minister in crisis. His decisions directly affect whether Scotland has the funding required to keep its people safe. That is the ridiculous reality of devolution, but it's a reality that must be addressed. So will the Prime Minister now confirm what the residual funding for testing will be to enable the Scottish Government to pick up the pieces of this chaotic withdrawal of support? Mr. Speaker, it makes the case for Scotland to take necessary measures to keep our people safe. We need the financial ability to make our own choices. That, Mr. Speaker, only comes with independence. Mr. Speaker.
I will also hear the Leader of the Opposition in silence. I don't need the barricade. He certainly doesn't need it. I don't need it in Blackford.
Thank you, Mr. Speaker. PCR testing, the legal requirement to self-isolate and access to lateral flow testing have been instrumental, Prime Minister, in containing the virus. As we move forward to live with COVID, these are the very safeguards which support a return to normal life. And these short-sighted decisions have long-term implications. They also hamper vital surveillance efforts and impede the ability to respond to new variants. Mr. Speaker, the reality is that we have a Prime Minister beset by chaos and mired in a police investigation for breaking his own COVID laws, and he can shake his head, but that's the reality, Mr. Speaker. A Prime Minister who has no moral authority to lead, desperately seeking to appease his backbenchers. We know this reckless statement flies in the face of advice from scientists and the World Health Organization. That's because this statement is not about protecting the public. It's about the Prime Minister scrambling to save his own skin.
Well, Mr. Speaker, you wouldn't believe it from what the right honourable gentleman has just said, but the cooperation between the UK government, the Scottish Authority, has been outstanding and will continue to be outstanding. And I can tell him. He asked about free tests and how they're to be paid for. It's very important. The free tests will, of course, continue until the beginning of April. And of course, if people want to continue beyond then, and I set out for the House the reasons why we think it's much more sensible to focus, Mr. Speaker, on surveillance and spotting new variants, put our investment into that rather than mass testing. Then he has, Mr. Speaker, access to the 41 billion record settlement that he has under Barnett. And he also, Mr. Speaker, has access to hundreds of millions from the health and care levy. The only astonishing thing is that he voted against it.
Thank you, Mr. Speaker. I warmly welcome the statement the Prime Minister has made. The Prime Minister will also be aware of growing international evidence that lockdowns have been largely ineffective in preventing COVID mortality. And we're acutely aware of the massive damage which has been done economically and to non-COVID health of the people due to lockdowns. Will he review pandemic planning for the future to make sure these crucial lessons are learned?
Yes, I thank my right honourable friend, and he's right to draw attention to all sorts of studies about the efficacy of lockdowns. We'll look at all the evidence. I happen to think that the collective actions of the British public were indispensable in saving many thousands of lives, Mr. Speaker, but I'm sure that all the evidence will be looked at in the course of the inquiry.
Hilary Benn.
Thank you very much indeed, Mr. Speaker. New antiviral drugs have made a huge difference to the treatment of COVID. They are indeed, as the Prime Minister says, the first line of defence, but they work best when given early. Now, one of the requirements at the moment in order to qualify to get an antiviral drug is that the person has tested positive for COVID. If the Prime Minister is going to get rid of free lateral flow tests, how are people going to get access to those medicines?
Mr. Speaker, obviously, great respect to the right honourable gentleman. People who are symptomatic will, of course, continue to have access to testing.
It's a birthday person, Sir Britcliffe.
Programme is the reason that we're in this position today, and I want to take this opportunity to thank everybody involved in Highburn and Haslingden for the rollout of the vaccination programme and those who have had to deal with the restrictions for longer than most. But does the Prime Minister agree with me that this is exactly why we must learn to live with the virus due to how damaging restrictions can be on mental health and well-being?
Mr. Speaker, my honourable friend is absolutely right. And we have to set all these decisions, the cost of lockdowns, the cost of on people's mental health and well-being, against the difficult decisions that we have to make about opening up our society. And I think the House understands that. I think this is a balanced decision that is entirely right. And I should just clarify to the right honourable gentleman that, of course, those who are vulnerable, who are symptomatic, will, of course, continue to have access to testing. And I should have said that in my answer to his question.
Barbara Keeley.
Thank you, Mr. Speaker. In a recent survey, the majority of NHS leaders agreed it was not the right time to end free testing for the public. Can the Prime Minister tell me why he disagrees with those NHS leaders and what scientific advice he has considered to come to this decision, which could have a real impact on the NHS elective recovery plan?
I hear the anxieties of people, but I have to say that I think that this is the balanced and the right decision. Testing, and I just remind her of what her benches have previously said about the cost of testing. We now think that the best thing to focus on is, given the severity of Omicron, the best thing is to focus on surveillance and to use the huge funds that we're currently dedicating to mass testing on electives and all the other things that we need to do.
Clark.
Thank you very much indeed, Mr. Speaker. Sir Andrew Pollard of the Oxford Vaccine Group said this morning that it doesn't make a big difference whether the decision to lift these restrictions is taken now or in a few weeks' time. So it's not clear what the purpose of waiting any longer would be. But one of the things that we do know in the past is at times we didn't have the testing capacity that we needed at times when we needed it most acutely. So given the ongoing surveillance, if that were to throw up a variant that was more dangerous than Omicron, how quickly can we stand up and deploy again mass testing?
I thank him, and that's exactly the right question, Mr. Speaker, and that's why we're putting so much emphasis on surveillance, on the ONS, with its amazing granular ability to detect what is going on in local areas, as well as other forms of surveillance. We want to spot the new variant of concern as soon as we can, Mr. Speaker, and then we want to surge our testing capacity in the way that we did before, and of course much faster now, since it is all ready to go. We will have stockpiles, Mr. Speaker. We will keep our labs in readiness, and we will be able to surge where necessary. But now is not the right time to continue with mass testing. Or from April, it will not be the right time to continue with mass testing in the way that we have.
David.
Can I join the Prime Minister in sending our very best wishes to Her Majesty the Queen and hope she gets well soon? Mr. Speaker, there are millions of family carers across our country taking regular lateral flow tests to ensure they don't pass COVID onto their vulnerable loved ones. The Prime Minister now says these families' carers must pay for COVID tests out of their own pocket, even though so many family carers can hardly make ends meet at the moment. Is the Prime Minister really telling people they must choose between money for the weekly shop or a test so they don't accidentally take this contagious virus into their loved ones' homes? Surely such a tax on caring would be unfair and unjust.
Mr. Speaker, my honourable friend is right to draw attention to the need to honourable gentleman's right to draw attention to the need to protect care homes and those who work in care homes. He should wait until March, when we'll be setting out in more detail those who will continue to be entitled to free tests.
The man for the rules, Matt Hancock.
Mr. Speaker, almost 2 years ago now, this House voted unanimously on the statutory measures necessary to keep people safe during the pandemic. And I agree with the Prime Minister that now, thanks to the vaccines, these measures are no longer necessary, and indeed that we're the first major country in the world to be past the pandemic. Yeah. But isn't it extraordinary that despite that consensus on restrictions back then, the consensus on giving people back their freedom, which is often so much harder, and trusting to personal responsibility, that consensus appears only to exist on this side of the House?
Yes, Mr. Speaker, and I think it's a great shame that the opposition cannot find it in themselves to support what I think is a balanced and proportionate approach, and one, Mr. Speaker, that recognises that COVID has not gone away and that we cannot throw caution to the winds.
Rod Shaw.
Mr. Speaker, given everything else the Prime Minister said this afternoon, why is he keeping the bureaucratic and irritating passenger locator form when the whole of the rest of Europe can already travel freely by showing a vaccine certificate?
Right. Well, a welcome call for liberty from the opposition benches, but I can tell him that we already have one of the most open travel systems in the world, and the passenger locator form, I understand his grievance against it. We are certainly reviewing it by Easter.
Sir John Redmond.
Great news that our freedoms are being restored. So can the Prime Minister now bring that same focus and government innovation shown on this topic to vanquish the cost of living crisis so that more people have enough money to enjoy the freedoms?
Yes. You bet, Mr. Speaker.
Thank you, Mr. Speaker. We do not know how well the vaccine works on immunocompromised people, and they and their loved ones will rightly be extremely worried. And as the Honourable Member for Leeds Central raised, there are delays in getting test results, thus delaying access to life-saving antivirals. Can we allow them to have a supply of antivirals at home? Because if his pharmaceutical interventions would save lives, let's make sure that they can access them ASAP.
Mr. Speaker, we've already secured more antivirals and therapeutics per head than any other country in Europe, and what we need to do is ensure that those who are clinically extremely vulnerable do have access to them, and 1.3 million of them have already been sent tests.
Colin Mumby-Croft.
Mr. Speaker, whilst the threat from COVID has changed, thanks in no small part to the outstanding vaccination efforts led by my honourable friend, the Prime Minister, he will know that the effects on local hospitals will last for years to come. Does he agree with me that now is the right time to invest in upgrades to hospitals like Scunthorpe?
Now is exactly the right time, Mr. Speaker, to invest in hospitals like Scunthorpe across the country. I cannot give a commitment to the particular project that she described, but it is the kind of project, Mr. Speaker, 48 of which, as you know, Mr. Speaker, we are progressing across the country.
First of all, can I welcome the fact that we're having these restrictions lifted, and I hope that the Prime Minister will engage with the Health Minister in Northern Ireland to make sure that the same measures are exercised in Northern Ireland. The Prime Minister said, though, that it is important that we get our confidence back. We have lived through 2 years of fear being instilled in the population. Can he tell us what nudge tactics he now intends to engage in to ensure that that confidence is restored so that people can get back to work, back into the shops and restaurants, and back doing the things which make life enjoyable?
Parties.
Perhaps I could begin, Mr. Speaker, by echoing the condolences for the DUP MLA, Christopher Stalford. And Mr. Speaker, I agree wholly with his sentiments. We do need people to get their confidence back. And as I said the other day, what I think people can do, they can set an example. They can go to work, Mr. Speaker. I think going to work is that. Well, you wait and see. Going to work, Mr. Speaker.
David Davis.
Cheer up the Prime Minister by welcoming what he has to say today. And say to him that the comment of the Leader of the Opposition that the government had no plan to deal with this was destroyed by his own right honourable friend, the member for Leeds Central, who pointed out that antiviral therapeutics were incredibly effective, 95% effective against this disease. And am I right, can the Prime Minister confirm that we have 2.75 million courses of such therapeutics available to us already?
No, Mr. Speaker, I can't confirm that. What I can tell him, in fact, we have twice the amount. We have 4.9 million doses.
Caroline Lucas.
Thank you very much, Mr. Speaker. Living with COVID does not mean ignoring it, and he will be aware that lifting of restrictions today flies in the face of advice from many NHS leaders and health experts, including the BMA and the World Health Organization. And saying everyone should take personal responsibility, while at the very same time taking away the very means that would allow them to take that personal responsibility, is utterly perverse. So what would he say to those of my constituents, particularly those who are clinically extremely vulnerable, for whom his Freedom Day is a day of profound fear and loss of freedom? And would he clarify his response to the Right Honourable Member for Kingston and Surbiton? Because it's not just an issue of free testing for people in care homes, it's a question of free testing at the very least for the almost 7 million carers up and down this country.
So just on that, Mr. Speaker, she should wait, as I said to her right honourable friend from Kingston and Surbiton. And on the clinically extremely vulnerable, I think it's very important to remember that they do have, and we will continue as we have throughout the pandemic, to look after them with all the therapeutics that we can, with vaccines where that's appropriate. As you know, the House knows the shielding programme ended in September. But I think what people need to recognise with the CEV, with the clinically extremely vulnerable, is that we should treat them with caution, just as anybody with any respiratory disease should treat the clinically extremely vulnerable with caution, respect them and act with responsibility.
Edward Timpson.
Mr. Speaker, and I fully endorse the Prime Minister's statement. It's a significant step forward. But whilst also wanting to get more confidence back into the country, people also want some consistency so they can plan ahead. And to that end, will he look at what we do with schools and education more generally, particularly around making them an essential part of our national infrastructure, so that in any future occasions where we may be considering restrictions across the country, schools, nurseries, colleges and universities are at the very back of that queue, so that we make sure that that lost learning we saw during this pandemic doesn't happen again?
My honourable friend makes an excellent point, and that's why we're ensuring that schools are able to be as COVID secure as possible, sending out 350,000 CO2 monitors, 9,000 air cleaning units, amongst other steps that we're taking to protect schools. And I think it's very, very important that we should get the message over to everybody that schools are safe, and not one of the many things, Mr. Speaker, that the Leader of the Opposition got wrong.
Alex Davis-Jones.
Mr. Speaker. The Prime Minister, in outlining his reckless plan for living with COVID, announced that he is relying on the British public to apply personal responsibility when it comes to the virus. Does this also apply to the Prime Minister?
She says it's a reckless plan, Mr. Speaker. That was exactly the word that the Right Honourable Gentleman Leader of the Opposition used to describe the July 19th openings. I wonder whether she still believes that.
Al Carper.
Mr. Speaker, I'll take the Prime Minister's statement, if I may, as his application to join the COVID recovery group. He's very welcome indeed. I only wish it had been sooner. Can I ask him a question, though? On all of the lockdowns and the serious restrictions have all been implemented using the Public Health Act, some of them by ministerial decree, only approved by Parliament retrospectively. If we're to believe that next time will be different, why doesn't this plan include proposals to change the Public Health Act to make ministers more accountable to Parliament now, rather than kicking it into the long grass, waiting for the results of the COVID public inquiry?
Well, I know that my right honourable friend is a staunch Thatcherite, and he will recall it was Margaret Thatcher who actually promulgated the Public Health Act in 1984. It has served this country well for a long time. I'll consider the point that he makes. It is a valuable one, but I think it may also be something that the inquiry will want to consider themselves.
Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. With 38,000 new COVID cases today, can the Prime Minister explain which public health experts advised abandoning testing and isolation, and when will that advice be published?
Yes, I thank her very much. And as you know, cases are falling, hospitalisations are falling, and the number of excess deaths from Omicron is actually in negative territory, and we consult a wide range of scientific opinion, including SAGE and clearly CSA and CMO, but the decisions are for ministers, and we take them.
Lee Anderson.
Thank you, Mr. Speaker. Now then, unlike the opposition, the Prime Minister has got all the big decisions right through the pandemic. But will he agree with me that we should never return to a full lockdown, and any isolation should be targeted? It should be the clinically vulnerable, the elderly and the Labour front bench.
Not in that order.
Mr. Speaker, my honourable friend has put it brilliantly and succinctly, and I have nothing to add.
Chris Bryan.
Thank you, Mr. Speaker. Liberty is always better than the alternative. As long as everybody can share in that liberty equally. So the anxiety for some of us, especially those who represent very poor communities, is that if you are symptomatic and free testing is ended, you may end up having to pay £59, £119 for a PCR test. And then on top of that, if you do the responsible thing and stay away from work, you may be in a job where you're not going to get any money at all, or you're going to get pathetic sick pay. Don't we have to make sure, if we are going to make sure that everybody shares in that liberty equally, that the poorest in Britain get a better deal?
The right honourable gentleman makes a very important point, but I think that overwhelmingly, first of all, there will be statutory sick pay available, but secondly, I think if I may say so, I think he underestimates people's sense of responsibility, and also people's willingness to do the right thing by others.
Mr. Speaker, I welcome what the Prime Minister has set out today, and I especially welcome his commitment to Scunny Hospital. And I also welcome his continuation of the ONS survey study, not least because my mum and dad have been taking part in it, and it's given them something to do throughout the course of COVID, rather than text me constantly. But can I, on NHS testing, as somebody who knows works in the NHS myself, I like getting my test before I book on duty. It makes me feel safe when I'm going into care homes to attend patients or elsewhere. So as he sets out how testing will continue in March, can he set out clearly what the situation will be for testing of NHS workers?
Can I first of all thank my honourable friend very much for his service in the NHS and throughout the pandemic, and I've seen him in action, but also to say that on his point about the NHS, that will be for the NHS to determine themselves.
Lawrence Session-Lurby.
Thank you, Mr. Speaker. The Prime Minister mentioned this afternoon it's about personal responsibility, and it is. It's about our personal responsibility not to inadvertently pass on that virus to someone who's vulnerable. It's about our personal responsibility to do the right thing if we have the symptoms and if we have COVID. It's about our personal responsibility to think about our neighbours, our friends, our carers, the people who need those restrictions lifted. What does the Prime Minister have to say to my vulnerable constituents in Vauxhall who are concerned that this personal responsibility that the Prime Minister wants us to take may inadvertently lead to them catching COVID?
Prime Minister.
I thank her very much, and she's right to focus on personal responsibility, but the other part of the strategy is the vaccinations. And this is a vaccine-led strategy. And that's what enables us, and that's what enables us now to rely on people's personal responsibility as well.
For Manchester.
Mr. Speaker, can I very much welcome the statement by the Prime Minister and the way he set out the argument with regards to living with COVID in respecting and restoring people's freedoms and at the same time with regards to protecting public health. The key advance that we have for future, Prime Minister, is that we have the mapping exercise with vaccination centres already in place, such as in Medway. With that being the case, will the Prime Minister also thank the excellent volunteers and the NHS staff in Medway and look at their bid for a new Medway hospital in my constituency for the future?
Mr. Speaker, I better be careful what I say about more hospitals. We want to build as many hospitals as we possibly can, but we'll have to look at his plan. I do want to thank the Medway volunteers. I want to thank everybody still involved in the vaccination campaign. There are still millions of people, Mr. Speaker, who have not yet had their booster, and I urge them to get it.
Catherine West.
Lovely to have the Prime Minister with us today, not filling in his questionnaires or having his busy meetings with the police. Mr. Speaker, can he confirm or deny the reports that there is a sell-off plan to the Vaccine Manufacturing and Innovation Centre, which has been founded on the values and the mission of people like Dr. Sarah Gilbert, who invented the AstraZeneca vaccination? There are rumours going about that this public-private enterprise will be sold off to the private sector. Will he confirm or deny what is the government's intention? Because the essence of the reason that we were ahead with the vaccine was the excellence and the values of those wonderful British scientists who worked their socks off to get this. Don't just sell it off.
Mr. Speaker, I might also add that one of the most important factors in the success of the vaccine rollout was the private sector, and it was private sector investment, Mr. Speaker, that led to the AstraZeneca vaccine, the Pfizer vaccines, and we will make sure that we work with the private sector to continue to develop this country's native indigenous ability to manufacture mRNA and other types of vaccines.
Speaker, keeping healthy people at home in isolation has had a devastating impact on lives, businesses and important life events like weddings. So I welcome these changes to trust the British people and to allow people to plan with confidence. Yet we all have constituents who are immune compromised and they're vulnerable, like the woman who wrote to me this morning. Unlike what the opposition budgets say, they do not have a monopoly on compassion. We care about these people. Will my right honourable friend just reassure again that these people will get the support they need and that the timing is right and there's no point in waiting for these changes?
Yes, she's absolutely right, Mr. Speaker, and we'll make sure that those people get not just the antivirals that they need, but also the tests that they need.
Karen Smith.
Mr Deputy Speaker, I think that's the point I would really like clarification from the Prime Minister, because I think we've learnt today that the 7 million carers won't get tests, NHS staff and care staff will have to be found within existing budgets, thus making those waiting lists even more precarious. But eligibility for antivirals is based on being over 12, being at high risk, having symptoms or testing positive for COVID-19, for which people will have to pay. Can the Prime Minister confirm that that is the case? And I see the Health Secretary is helping him out, but if you could clarify that for people, that would be really helpful.
Mr. Speaker, if she waits a little bit longer, she will get a breakdown of how we propose to support the most vulnerable. But we will support them, Mr. Speaker, as we have done throughout the pandemic.
Rebecca Lee.
Experts will argue for years whether we made the right choices, and some of us, for what it's worth, would have liked a lighter touch. But one thing is certain, and we know this from independent testimony which has emerged from a former advisor of the Prime Minister, that but for his freedom-loving instincts and libertarian instincts, these lockdowns would have been much longer and much worse, with incalculable consequences for the young and people's mental health. So can we rely on the Prime Minister in the future to rule out any more lockdowns in the coming decade while he remains Prime Minister?
What you can certainly rely on, Mr. Speaker, is that this government will take the tough decisions to protect the British people, and we will have a vaccine and science-led approach to dealing with this pandemic.
Simon Mulhotter.
Thank you, Mr. Speaker. The Prime Minister has come to the House today unable to state whether carers in our communities, visiting home after home in one day, often of older people and those who are clinically extremely vulnerable, will still have access to free tests in order to keep themselves and their patients and clients safe. He has now said that testing for NHS staff will be a matter for the NHS. Surely he can do better than this. Even the NHS and carers need to be able to plan ahead for what is coming. Won't he come clean with the House today about his intentions?
Mr. Speaker, what we're doing is moving away from systematic mass testing of large numbers of people, which is no longer the right way to deal with Omicron, to a surveillance-led approach. And of course, we will continue to look after the most vulnerable and those who need it, Mr. Speaker.
Peg Williams.
Thank you, Mr. Speaker. Can I welcome the path to freedom the Prime Minister has set out? And I am sure that as the Leader of Opposition, the Welsh First Minister will condemn the plan today, but in about 2 weeks present the same plan as his own. So could I ask my Prime Minister to reach out to the Labour First Minister and the other devolved administrations who we have worked well with when ugly nationalism is put aside, to get those freedoms for the residents of Montgomeryshire as quickly as possible.
I thank my honourable friend, and I indeed, as I extend the hand of cooperation to our Scottish friends of the Scottish administration, I hope that the Welsh administration in Cardiff will see the way forward. And as I've said many times before, the similarities in our approach greatly outweigh the differences.
Clive Afford.
It's hard to imagine that this is the Prime Minister that missed five COBRA meetings at the start of this pandemic. My constituent, who spoke to me yesterday, who's immunosuppressed, anticipated the difficulties that the Prime Minister is having over testing for people who are clinically vulnerable. She wanted to know whether she was going to have ready access to free tests and whether she was going to get ready access to antivirals should she test positive. And what is the situation that those people are being plunged in today?
I thank you very much. The answer to those questions is yes and yes. So for the 1.3 CEV, 1.3 million clinically extremely vulnerable, they will of course be given access to testing, free testing, Mr. Speaker, and they will also have access to the largest quantity of antivirals and therapeutics per head of any European population.
Alberto Costa.
Thank you, Madam Deputy Speaker. With a world-leading successful vaccination programme, with the fastest growth rate in the G7, and in my South Leicestershire constituency, some of the highest employment that we've seen in generations, does this not demonstrate that during this COVID pandemic, when it comes to the big decisions, this Prime Minister and the government he leads has got them right?
Yes, Mr. Speaker, I have to say, look, I'm casting modesty, if not caution, to the winds. Yes, we have got it right, Mr. Speaker, though there have been some very difficult decisions, and would have been nice today, finally, to have had the support of the opposition.
Rupa Huck.
Madam Deputy Speaker, thank you. I'm sure the whole House will join me in paying tribute to my constituent Jamal Edwards, a musical pioneer taken from us way too young yesterday. The Prime Minister justifies this crowd pleaser for his own MPs with warning us about damage to the economy. But can I ask him, when the ONS say that 1.3 million of our fellow citizens are suffering from the debilitating condition of long COVID, which actually has rendered 396,000 people economically inactive. It causes dysfunctionality, it ages people by 10 years. What is it that this Prime Minister is doing to advance research and treatment into this condition? And how does today's exercise help those people?
She's absolutely right, Madam Deputy Speaker, to mention the problem of long COVID. We've invested £224 million into expanding NHS treatment of long COVID, and we're putting another £50 million into research into that syndrome.
Henry Smith.
Thank you very much, Madam Deputy Speaker. I very much welcome the Prime Minister's statement today, a return to liberty, so that we can further grow our economy, so that we can tackle those other health conditions. But can he say a little bit more about what targeted support will be provided for those who are immunosuppressed and immunocompromised, such as those with blood cancer?
And then I thank him very much. So we've secured supplies of monoclonal antibodies, as I told the House, in record numbers. But what we'll also do is make sure that those who are immunosuppressed have access to testing to see whether they need the therapeutics.
Gavin Newlands.
Thank you very much, Madam Deputy Speaker. The deep irony about this Prime Minister election as in personal responsibility won't be lost on the public watching at home. And to misquote Kevin Bridges, personal responsibility won't pay the bills. But, Madam Deputy Speaker, he called for a full nation's approach, time and time again, bemoaning any deviation in approach in Cardiff, Belfast or Edinburgh. Now he is recklessly, dangerously dropping all restrictions in England ending community testing without consultation or consideration of devolved needs and flying in the face of the scientific advice he has been given. This just proves that his full nation's approach is simply meant to follow Westminster's direction, no matter how rash, doesn't it?
First of all, Mr. Speaker, Madam Deputy Speaker, we're not dropping the testing until the beginning of April, as he knows, and it's only thanks it's only thanks to the massive financial firepower of the UK that we've been able to run the biggest testing. We've been able to run the biggest testing operation in Europe, plus the fastest vaccination rollout.
Michael Fabricant.
Thank you, Madam Deputy Speaker. Can I ask my right honourable friend to cast his mind back to January last year, when Chris Whitty said there will come a time when COVID will be the same as flu, where actually there are 7,000 to 20,000 deaths each year. At that time, there was no comment against him from either the Labour Party or the SNP. Now that we have excess deaths at minus 9% of what is normal at this time, is he as baffled as I am about the attitude that the Labour front bench now has?
Yes, actually, Mr. Speaker, I am. I thank you very much. I'm genuinely surprised by the approach that they've taken today. I do think it is wrong, but I think you're making an important point about the comparison with flu, because it is very important that people with any respiratory disease think about those who are clinically vulnerable and behave in a responsible and considerate way.
Chiomora.
Thank you, Madam Deputy Speaker. A plan for living with COVID which does not provide for older and extremely vulnerable people, which does not include school children or sick pay for the working people or testing. Isn't it the case that this is a plan in the same sense, only in the same sense, that his birthday was not a party?
No, Madam Deputy Speaker, this is a plan that addresses every single one of those priorities. Sick pay, schools, the vulnerable. This plan deals with all of them, and I think it's the right way forward. And I think actually she should support it.
David Evans.
Thank you very much, Madam Speaker. I strongly welcome and endorse my right honourable friend's statement today, restoring our freedoms. Would he agree that the restrictions, although necessary, have taken a very heavy toll on businesses and our society, and we have to live with the virus for the future? However, on this side, we passionately believe in trusting the people to take personal responsibility.
Beautifully put, Madam Deputy Speaker.
Patrick Grady.
Madam Deputy Speaker, are the 100 million doses of vaccine
being donated as part of the global response counted towards or in addition to the government's 0.5% ODA target? And when will it stop blocking agreement on a TRIPS waiver so that developing countries can take vaccine response into their own hands?
Hear, hear.
He's raising a very important but very difficult issue. And I spoke, in answer to the honourable lady opposite, I mentioned the importance of the private sector. We do need to ensure that the pharmaceutical companies have the wherewithal to make these colossal investments that offer hope for humanity.
Chris Clarkson.
Thank you, Madam Deputy Speaker. I want to start by congratulating my right honourable friend for his forbearance, because across that dispatch box, first he was faced by the vacillations of general indecision, and then by the rank opportunism of Captain Hindsight. So does my right honourable friend agree with me, if he'd listened to Lieutenant Lockdown there, instead of having the first major economy to unlock and a world-leading vaccine programme, we'd now be facing a major catastrophe?
Yes, Mr. Speaker, and the most important thing, Madam Deputy Speaker, is that we would not, if we'd taken those steps, if we'd remained in lockdown, we would not have the financial wherewithal, the firepower, the money to pay for all the things that the people now need support with, not least, Mr. Speaker, Madam Deputy Speaker, clearing the COVID backlogs.
Grant Davis.
Thank you. The Prime Minister says that this is a scientific decision. So can you remind the House what the current R rate is, the reinfection rate, what it's projected to be by the start of May, and at what level of R rate is he willing to reintroduce testing and self-isolation? Or isn't it a scientific decision?
As I've said earlier on, Madam Deputy Speaker, the rate of infections is falling, and so are hospitalisations.
Teresa Villiers.
Aspects of the pandemic has been that many people have been unable to visit their sick or even dying relatives in hospital. And visiting has still been very difficult, even with the improvement in the COVID situation. Well, will the Prime Minister make sure this day is when NHS visiting requirements in our hospital go back to normal? Because that is the humane and compassionate thing to do.
Madam Deputy Speaker, I thank my right friend very much. I know she speaks for millions of people around the country. I can tell her that many restrictions have already been lifted, and they will continue to be lifted.
Stephen Timms.
Thank you, Madam Deputy Speaker. 3 years ago, the government consulted on much-needed reforms to statutory sick pay, rightly recognising that the current system is inflexible and doesn't reflect modern working life. Those reforms were postponed when the pandemic hit, and instead day one access to statutory sick pay was introduced. I think he's just announced that day one access to statutory sick pay is going to be withdrawn in a month's time. Will he then now bring forward the much needed and long delayed reforms to statutory sick pay?
As the right honourable gentleman knows, that statutory sick pay is only a part of what many employees already receive as part of their sick pay.
Duncan Baker.
To remind people, the Prime Minister was right last July when we came out of lockdown.
And we're going to leave the Prime Minister's statement on COVID restrictions in the Commons there. And we are back in Ukraine with some breaking news this evening, and that is that Vladimir Putin, the president of Russia, is due to make a statement to the nation, according to state media in Moscow, and he will do that pretty soon, sometime, we think, within the next half an hour. It all follows a meeting of his Security Council, an unscheduled meeting of his Security Council earlier today. Joining me now is our Security and Defence Editor, Deborah Haynes. And as I was saying, Deborah, it follows this rather odd and very public Security Council meeting earlier today, and now this address to the nation.
Yes, it was quite an extraordinary session, wasn't it, that we saw on television of President Putin and his top security chiefs and foreign minister. It sort of seemed almost theatrical as they discussed through their version of events in terms of what's happening here in Ukraine. And President Putin, during that meeting, it was all kind of about whether or not, or what to do about the situation in the Donbass region. Those two breakaway regions of Luhansk and Donetsk that has been the heart of what had been a frozen conflict in Ukraine since the annexation by Russia of Crimea back in 2014 and the backing of separatists there. And the President saying that he would make a decision today on whether to recognise the independence of those two regions. Were he to do that, analysts have said, that could provide a pretext potentially for Russia to send military troops overtly into those regions under the guise of offering some kind of protection. Over the last few days, we've heard claims that citizens there are under threat from the Ukrainian armed forces. We've seen pictures of them being transported over the border into Russia. Ukraine's government has categorically denied posing any such threat, and there's not been any independently verifiable evidence to suggest that the claims of this threat are true. In fact, far more likely is that this is the pretext, potentially, that Western officials have said they expect President Putin to concoct in order to justify military action, potentially, in Ukraine. We aren't there yet, but this is a worrying step were that to happen. And the fact that you now have President Putin addressing his nation, we don't know exactly what he's going to say, but if it's about this issue, which you can imagine it most likely